Sharleen, Dr. Tony.
Hello, nice to meet you.
You too. Quick Spine Show is my show too. What's your show?
My show, Empire Acupuncture.
Yes. And what city is this?
Rancho Cucamonga, California.
Yes, it is. I'm in Upland, so we're neighbors almost. Okay. We want to talk about acupuncture. I understand a little bit of it. My audience probably has no idea what it does. What I've seen, it has grown the last 10, 15 years as a valid therapy to help people get better, and especially for my sense, pain management, to get themselves to heal from that, not just medications over time.
Yes.
Okay.
Yep.
So go ahead, tell me how you got in this field.
So I got into acupuncture because I actually was thinking to leave accounting, the world of accounting in college. I did not want to work in business in that capacity, and I just wanted to help people. I loved medicine my whole life, and I just didn't love the conventional medicine model.
Well, take back, so why did you love medicine? Like,
I was so fascinated by how the body works. I always have been. Even as a child, I was a gymnast. Both of my parents coached gymnastics. All my siblings were gymnasts.
Got it.
And it was just interesting seeing how the body worked, and watching these elite gymnasts. I was a terrible gymnast. We'll put that one out there.
Well, you gained you confidence, self-esteem, physical ability, blah blah blah. It wasn't all negative, but
watching these elite gymnasts perform, and just the way that their muscles work together and the kinesiology of it just fascinated me from such a young age. And I've always had a strong belief that the body is such an incredible, I'll say machine for lack of a better word, but how it just can heal. And when you're working out, we're constantly ripping our muscles apart, and they're rebuilding, and that's why they get bigger, and you get bigger muscles and stronger. And I've just always been fascinated by that from a young age.
Yeah, and with chiropractic, we believe that, not believe, but the body is, like you said, self-healing, self-regulating.
Exactly.
So when it works on its own physiology, the body can heal on its own if you give the right nutrients, if you're not deficient in something, or if you're not basically toxic with something else.
Yep, and that's exactly the theory in acupuncture as well.
Yes.
A lot of my patients will come in and think that I'm doing the healing. I am a vehicle to tell the body.
Shoulder. Good work.
Yeah. I am a vehicle to tell the body that it already knows how to heal itself. We're just reminding the body of that. That's all any acupuncturist does, and probably even
chiropractic. Don't tell my patients that, but I don't fix everything. But a lot of it is people. Why don't people know that off the get-go? Why isn't that taught normally?
I think it's just something, it's foreign. It's still, I try not to use the Chinese words with my patients too much.
Why?
Because I see
Chinese?
them, they're not, but I see their eyes kind of gloss over a little bit. So when I start talking about qi, it's a word that we don't even have a proper translation for in English.
But close is
energy.
Got it. Yep.
But we don't have an exact translation in English. So when I start talking about qi and the spleen, and people think that their spleen is, their actual physical spleen is having a problem, it's not.
You want to be at whatever people level they're at, language-wise or education-wise. How do you go where they are? In my sense, at that point, build a little bit more, and over time a little bit more, so they have to understand what's healing them.
So I like to I like to ask a lot of questions.
Good.
And based on the words that they use, the feedback they give me, that's how I can assess. I have some patients who love to live in the woo-woo land, and they love hearing about the qi, and they love hearing about the channels in the body and the meridians and stuff like that, and how all they interconnect. Yeah. If that's what they want to hear, I'll talk to them in that language. I also have a lot of patients who come from the conventional medicine arena, so they're nurses and doctors. Yeah. They don't want to hear about qi. They want to know that I'm decreasing inflammation in the body. We're getting their blood flow better.
How you're healing my body the way I understand my body can heal.
Exactly.
That's all it is. And I think and everyone's different, right? Some people come in, hey, I have to go back to work. I have kids at home. I have a long drive to get home or get to work. Can you help me today?
Right. And
so you have so many different, sorry, cut you up, the spectrum of people that want information that may not want to understand today, and somebody that may want to go, hey, look, I'll have no problem sitting an hour with you and discuss how acupuncture works.
Yeah, absolutely. And there are a lot of those patients, especially, everybody has a busy life, right? And we all have these crazy drives down here in Southern California. People want to be healed right away. And that's another part of the acupuncture world, and I'm sure you do this in chiropractic as well, is educating our patients on, okay, how long have you had the injury? How long did it take you to get here? I'm not going to turn your world around in a day. Not
a spiritual healing.
Yeah. It's like can I get you relief today? Absolutely. Is it going to be everlasting? Probably not. We need, I educate my patients on what the treatment plan is, what they should expect. Sometimes things get worse before they get better. And, they need to have that right expectation, that right understanding, because I don't want to send a bunch of people away walking around saying acupuncture doesn't work, because nobody understands it in the West.
Someone says, I had problems for 10 years of pain. Acupuncture started one time, and I was healed completely. Like, oh, that's going to be like expectations here.
Yep.
No one can get there.
And I have a handful of, I call them my miracle patients. I do have a couple of them. It happens. Some people, but the common thread that I see among those people, my miracle patients, is they have perfect diet. They have a perfect for them exercise regimen. They keep their stress down and they enjoy life. And those are the biggies. And so my patients that don't get better in one shot, they probably have a crappy diet. They're exercising.
Watch your language. It's Facebook. They made banners. I don't know. Good.
They are not exercising properly, if at all. They just live their total stress balls, and they might not be enjoying life right now because they're probably in pain or sick.
Well, one thing you mentioned too is with acupuncture, like similar to what I do, is how do you look at the person as a whole, their whole lifestyle, what they do when they wake up in the morning until they go to bed, and how do you consider, is that healthy or unhealthy? And how do you change it over time?
So I am looking at the whole person, and the first time I see a patient, I actually spend 2 hours with them. It is a long intake. We go over all of that stuff, even down to the emotional level. I ask them specific questions emotionally. I find out about their diet, their exercise, because a lot of people think that certain things are healthy, and they're not. And
are they just naive, correct?
It could just be naive or ignorance. It could be misinformation over the last 20, 30 years.
Yeah, that's what I worry about.
And so just properly educating them on the new science that we have, especially around nutrition.
It's new old science, correct?
New old science.
Okay, got it. Just terminology out there.
Yeah. Well, and especially when it comes to nutrition. Yeah. I call it new science because 30 years ago, fat was bad for you. Nowadays, fat is good for you, the right types of fat. So that's why I spend so much time with my patients in that first intake, is because I want to get to know their lifestyle. I want to know, are they having issues at home? Is there something within their control that can help mitigate the issues that they're having?
Well, like you said, it's something to where, when you sit someone like in a medical doctor's office and go, if I'm to tell my doctor all my problems, you're not really seeing the person.
Right.
There's just for the back pain, the neck pain, the neuropathy, whatever is going on.
Yep.
Like you said, the whole person may be something in their arm, but it coming from their neck and can get stress in their life, causing that to become irritated over time, or a dietary issue, or a lifestyle issue too.
Well, and the beauty of Chinese medicine and acupuncture is it's all connected. We have these giant channels. We have 12 primary ones and then 2 additional, what I like to call primary ones, that run along the body. Some of them run all the way from the toe all the way up to the top of the head. Others are a little bit shorter, maybe the hand up to the head. But these channels, they're going across organs, all the way across the skin.
So they link to everything in the body.
Exactly. So I can use points on the skin to treat internal medicine issues.
Nice.
And then something that my patients are always blown away by, I use a specific style called Master Dong acupuncture, which is distal needling. So I don't often actually treat the local spot. So if somebody has shoulder pain, and let's say it's coming from the top of the shoulder here, that's going to be the gallbladder channel, which is one of those really long channels that goes all the way down to the bottom of the feet. I'm actually going to use points on the feet to relieve their shoulder pain. I'm not going to touch their shoulder at all.
Wow.
And it's extremely effective. And then when you have somebody who's in extreme pain and doesn't want the area touched, I have a tool to get it corrected without actually having to aggravate the issue.
And we always think, like, if that shoulder hurts, I have to go there and fix that. You give some way to redirect. Hey, this is how the lines work. This is what shows on how things link. At that point, I'm going to treat this and see how you do.
Yeah, exactly.
That's amazing.
Yep.
And when they get the relief, what kind of relief do they get? How does that work? Does it time frame? Does it take time?
It does take time. Okay. So most of the time, especially with the Master Dong style acupuncture that I use, that distal needling, we will get some relief pretty instantly. Okay. It might not be pain of, 9 out of 10 pain, severe pain. I'm not going to get them down to a 0 most likely,
it's impossible.
Yeah. I'm probably going to get them down to like a 7. But for people who have had chronic pain or even acute pain for a few days, they know that a 7 is better than a 9.
They'll take anything but a 9.
And an even more awesome part of this style of acupuncture is if I'm treating somebody's shoulder and I put a pin there and then I want them to move, they've got needles sticking out of them.
Yeah.
They don't really want to do
torture.
That. Exactly.
Yeah.
So if I treat a point on their foot and then I ask them to move their shoulder and say, tell me what the pain relief is, or do you have any relief right now?
Yeah.
Oh yeah, it went down, it's like a 7 now. I can't get it back up to a 9. Okay, I stimulate a little bit more. Okay, I'm down to a 5. All right, lay down, rest.
Give it time to heal.
I can get instant feedback from the patient, is it working? And then from there, we need to continue treatment to be able to get them to as low of a pain scale as we possibly can.
And walk me through how that works. If you're putting needles on someone's foot, helping their shoulder, how does that system work?
So what we know scientifically is I use contralateral. So if the person's left shoulder hurts, I use their right leg. So what that's doing is it's sending a nerve signal through the body and it's actually crossing hemispheres of the brain. So it's lighting up additional sensors in the brain, which is why it's so effective, because the body's saying, hey, something's going on. I have this little micro trauma. There's a tiny needle inside me right now. I have to cross over to the other side of the brain to figure out why. Oh, let's go fix the shoulder. Done. Yeah. So
it actually... Is it through the spinal cord or the brain combination? Is it linked through all the nerves in the body?
It's linked through all the nerves. So we do have a lot of interesting functional MRI data these days that show all of the major acupuncture points on the body, which there are, of the standard points, there are 365, and then depending on the model you use, there are even more.
That's a lot to remember in school. It is. Dang it, how many you have to know today?
Yeah, it is. It's a lot. But of the 365 main points with the functional MRIs, all of them center either around major nerve bundles or major vascular bundles. So we're affecting the blood and the nerves.
What is a bundle? What's a nerve bundle? Because people may not understand what this means.
Okay, so it's just... I'm kind of a layman with that. You probably know more about nerve bundles than I do, but it's just a high intensity cluster of nerves. So, we have large nerves, like right here we have the great saphenous nerve that goes through the front of the leg, and at a point that's, a few inches up on the shin, there's a big cluster where that great saphenous nerve branches off into smaller little nerves.
So it's like a little wiring system per se.
Exactly,
that's your source. At that point it branches off further and further. Brain, spinal cord, and gets a little bit more. I don't call it thin, but smaller.
Yeah.
Are the thinner nerves more sensitive? The smaller nerve, is there a correlation there?
Not that I'm aware of.
Okay. You know what I'm asking. I don't know.
Yeah, I don't know if they are. Each point can be more or less sensitive for different people and at different times. So with women,
what does that mean? Yeah.
So with women who are approaching their cycle, they're about to start their period, they become more sensitive to the needles typically. And then it just depends on the person. I'm a total weenie. I am awful with getting poked, even if I have to do it myself. I know, it's awful.
How did you get through school not being a subject for another student?
No, I was a subject.
I
would lay there and sweat and get the table paper all soaking wet.
That's awesome.
It was awful.
Awesome for everybody else, but awful for you. Okay.
Well, and what's awesome about it actually is that because I'm so sensitive, I trained with a certain mentor in my school who's a Japanese style acupuncturist.
Okay.
The Japanese tend to use thinner needles. They don't needle as deeply. And so I trained with him all 4 years to do that gentle technique because I can't handle it. I don't want to do that to other people.
So congratulations, patients here. You're actually going to get someone more sensitive, not going to poke you or hurt. It's good.
And it doesn't hurt. People are so shocked at how little you feel, if anything.
Well, they used to, like you said before, naive and used to modern medicine where you go to get your blood drawn and all of a sudden someone's taking your blood and it hurts. And you have to try it again and it bruises. You're like, great, phenomenal.
Yeah. That is I don't even use the size needle. The smallest blood draw needle they use is a 28 gauge.
Okay.
I don't even use anything close to that size. The ones I use are about as fine as a human hair.
Wow.
They're very small.
And with the skin itself too, how sensitive, at what level of the skin is pain sensitive? At my own curiosity, I guess.
I think the more superficial level, I would say, is... but when it comes with acupuncture, if you're needling really deeply, it's a really unique sensation that you get, and it's like this dull ache. And most people don't like it. It's uncomfortable, but it's not pain. It's not a sharp, awful pain like you would think of getting poked to get your blood drawn. It's this dull, achy sensation, and it's actually a really good sensation. When people share with me that they're experiencing that, or they ask if it's normal, I tell them it's a good thing because it's a sign that we're getting everything moving, the blood flow's increasing in the body, and when we have pain, we have these... I call them little traffic jams. There's a wreck on the freeway. Yeah. That's what's causing pain. There's a wreck on the freeway. You're stuck in that,
lack of circulation, lack of nerve flow.
Exactly. Yeah. So once we feel that little dull, achy sensation, it's like the tow truck has finally showed up. He got the wreck off the freeway, and now all those cars are starting to flow through. But it's still a little painful because... you're still dealing with the backup of that, and then once we get everything moved off to the side, SIG alert is green again, and it flows, and it's wonderful.
She's like one of those traffic reporters. Something on TV.
I listen to them all the time.
I avoid it completely. What I love is you're talking about is if the body's circulating fluid better, I mean blood flow, for example, or even nerve flow too, the body can actually be up to the point of, okay, the pain's going away, now the pain's reducing, now it can actually heal.
Exactly. Yep. Okay. Because
good. Yes, I got it.
You totally got it, because when we're in pain, we've all experienced some level of pain in our lives, I'm sure. And when you're in pain, you can concentrate hardly on anything else. And the body's doing the same thing. When it's in pain, it's constantly concentrating just on that specific pain, trying to get everything cleaned up, reduce inflammation, whatever it is. So by using the acupuncture, we get the body to relax, to stimulate that fluid flow again, and once everything's moving, the body can properly heal itself without being in like triage trauma mode.
And how long does it take to get to that point? If someone, say for example, has had pain for say a full month and now coming for care, what's it take someone, say ratio-wise, that month to get to where things go away and they heal so they stay away?
So typically, I would consider that an acute situation. So they've had it for only a month, which is not a long amount of time for what we consider chronic pain. And in that case, they would probably be back to normal in about 4 or 5 treatments.
Wow.
And that should be done over the course of only a few weeks.
That's phenomenal.
A month of pain, 3 weeks of treatment, and they're back to normal.
So a month out, they're going to be back to their normal, meaning not only are they out of pain, but also they've healed the problem causing the pain.
Exactly.
Great. And at that point, do you, like you said, initial intake, do you then work on their lifestyle choices and, hey, how do you, now you had a pain, this may have caused you pain in your lifestyle, how do you change that to a better lifestyle so now your body stays better?
Yes, exactly. Good. We talk about a lot of those things, and in that acute situation that you were just describing, like a month of pain, that's probably somebody who injured themselves either doing something at home, maybe they were climbing up on a ladder and they reached for something wrong, or a lot of my patients are CrossFitters and that type of stuff, so they probably got injured in a
keep up
workout.
With Johnny. Johnny's awesome.
Exactly.
And also I'm not Johnny.
So we do talk a lot about how to prevent that from happening in the future. And I was a fitness trainer for a few years, so I have a lot of not only understanding of just how the body works when it comes to fitness stuff, but how challenging it is for those people who love their fitness and they get injured, and then I tell them you have to lay off for 3 weeks and not go to the gym. And so I understand like how mentally painful that can be. Yeah, so we'll talk about that, and I try to like work with them, give them a little leeway, but it's important to just say, okay, here's best case scenario, you lay off of the workouts for 3 weeks, you come in for treatment, we get you taken care of, bam, you're done. Worst case scenario, you keep going and working out, I'm going to help you, you're going to feel better, you're going to work out, you're going to re-injure the problem, you're going to come back, you're going to spend more time, spend more money. Exactly. So do you want to be better in 3 weeks, or do you want to be better in we don't know how long?
Yeah, do you want to just continue to wait? And do you see the difference of people being compliant with care, men versus women, different ages, or how does that work with acupuncture? What do you see?
I would say the women are typically more compliant.
Yeah.
My male patients who are very compliant usually have a spouse in the background, a female spouse in the background, kind of, like
us
making
guys,
them stay
we're primitive,
compliant.
like, nope, I'm going to get through this, and all of a sudden, like, oh, I'm really broken now. I should have listened 10 years ago or a month ago what I should have done.
Yeah.
Sad guys. I'm one of them sometimes. Same thing I am. And what you do, too, what you said, we saw a post earlier with you, is you like to listen to your patients. What does that mean?
I have worked really hard. I love to talk, if you haven't figured this out yet.
You have information to say. Nothing about the news or anything, just some important stuff.
Right, no, I do love to talk about the important stuff. But I've learned in practice, some of my patients just need a doctor to listen to them. And they've gone from doctor to doctor. None of them have listened. And I really, if somebody gets on a roll, even if it has nothing to do with the question I ask them, I will just sit back and let them get it out. Because sometimes that's all they need to start healing in the first place. And I ask the hard and important questions. I ask about their emotions. I asked, have you, if you've been through any major trauma ever in your life? And sometimes that might be a childhood trauma. Sometimes it might have happened just a week ago. I've started treating a lot of patients for grief who've had major grief issues, and just healing some of those emotions that our society has taught us to hide. Sometimes that will heal whatever internal problem they have, and that's all they need is somebody to listen to them and to cry and use some Kleenex. And
like modern medicine too, your emotional link to your physical health is huge. And what I've seen or read, it's sometimes 10 times more effective to fix the emotional to help the body physically heal.
Yes, absolutely.
Listening to your patients, this already, you realize is that they build trust with you. Hey, look, I can go to this person for anything. Even though I may not be a problem with acupuncture, I need help with my pain or my medical health, what else can she help me with? When doctors, in general, this is one of my talks I've done like a dozen times already, when doctors sit down and listen to their patients, at that point they get a better state of their health, and you're having someone actually heal for the problem, at least get help for the problem, versus have to come back in because the problem you tried to help them before with less information didn't work. You can actually you listen enough to actually understand what they're going through.
Right, exactly.
And I wish most doctors understood that.
Like I think the post that I put recently on one of your groups was about listening to patients. You had put up a infographic of that, and I had said, I listened to my patient who she's been suffering from these terrible migraines for about a month now. She's been in and out of the ER as well as going to different doctors. They just put her on different meds. Nothing has actually really helped her. And she came in for the first treatment on Monday, and when I saw her in a follow-up on Wednesday, it was her daughter who's been bringing her in because her migraines are so severe she can't drive.
Wow.
So her daughter brings her in, and her daughter shares with me, she said that you're the first person who listened, and I was the only person who asked her about her emotional well-being. Well, it turns out exactly 1 year ago, she had 3 horrible, tragic deaths in her family.
Wow.
One each month for 3 months. And it's now the anniversary of that first one. Exactly when that tragedy happened. And so I wonder why her migraines just all of a sudden went out of control. And so I let her cry. I let her talk about that tragedy. And she keeps telling me, oh, it's because of that trauma. It's because of that trauma. And all of her other doctors thought she was crazy by talking about that.
Crazy because they didn't want to listen to her. They didn't understand the emotional attachment to the migraines.
And they're not trained in how to be able to treat it from that emotional standpoint. They have a protocol of treatments that they can give her these types of drugs for this type of diagnosis, and that's all they know.
Are you a trained psychologist?
I'm not. So
was a psychiatrist?
I'm not a trained psychologist or psychiatrist.
So you listen to your patients, though?
I listen to my patients.
It's not that hard.
No, it's not.
So if the doctors even though doctors aren't trained in psychology or psychiatry, if they listen properly, at least would give her a connection to her migraines, to her overall stress and trauma, give her a reason to.
Because I didn't specifically say, yes, your migraines are 100% related to this, but she said, I think they might be, and I said, I think they might be also.
Let's confirm that.
Yeah.
And does that help her with the anxiety of at least know where it may be coming from?
Right, exactly. And just
a lower stress level.
Yeah. And the fascinating thing in this particular case is the point I would use to help her get through the grieving process, an emotional point, is the same exact point that I would use to treat the physical pain she's having.
Amazing.
So if she had come to me and not said anything about this grieving process she's going through, I would have still used this point, lung 7, on the arm. And then when she tells me about this grieving process, we use this point to help people get through the grieving process in a healthier manner, because it is what we call a low connecting point. It's going to connect to that emotional part of grief.
Well, and 2 things you mentioned too. You're linking the emotional and the physical health, but also helping them get off the medications that weren't working in the first place.
Right.
Why wasn't the medications working? I know, but they don't know.
They're not actually treating the root of the problem. It's, treating the symptom, which in Chinese medicine is something we call the branch. Okay. You have, I have these trees behind here.
Hence, branches. I can't see them, but you'll see them in
trees have roots. Well, if you...
Smart, I like that.
If you do something to the root to disease it, the whole tree will be diseased. So same thing, if you treat the root of the tree, the whole tree will flourish and disease will go away. But if there's let's say on a tree, if there's mold or something, a disease just on the branch, and you chop the branch off, that mold's going to go deeper and it'll start attacking the root from the outside in. Well, if we start from the root and giving it proper nutrients and all that stuff, the disease problem will go away.
It's amazing when health is simple versus sometimes being overcomplicated.
Yeah.
Explain like that to your patients, even like a child. They're like, I understand the tree needs water and nutrients from the soil to work. Great, thanks for explaining my health.
Yeah, yep.
It's not that much. It's not that much with the human body. Wow.
And as complicated as the human body is, it's also very simplistic. And I think that's where medicine is really headed now, is let's be simple. Let's breathe. Let's eat the right foods and move. Why
is it getting more simplistic? What do you think?
I think people are really looking for that. I think,
supply and demand?
Exactly. I think we all have busy lives. Everybody wants a quick fix, but for the people who really want to do it right, who want to sustain their lives, they want to have the best life they can, they're looking for something that's simple and easy to incorporate.
It's a balance, right? We're all busy. We all have busy lives. We all want to do well, and we all want our families to do well too. But in another sense too, I've done the medical route. I've done the medications. I've done things that have had helped me or my family. What else is there? And we think about what else is there. Let's get away from technology and let's get into just basic human needs.
Yeah, exactly.
And what does it take me to stay healthy? Instead of eating, say, I drove by McDonald's today. It's there's a line out the street.
Yeah.
People, I mean, this is America. People think I want cheap, I want fast, but it's not good for me.
Right.
There's other people out there like, hey, look, I want to live a long time, not in a hospital watching bad daytime TV. Even though Judge Judy's awesome, I love her. I don't watch it every day, but something where you can actually live a healthy life by eating simple foods, exercising enough, lowering your stress levels, and minimizing things so you don't overwhelm your body.
Right, exactly. And we've been so overwhelmed for generations, but it's compounding this overwhelming nature that we live in anymore, because our parents' generation wasn't as overwhelmed. Their parents weren't, but now with the technology age and everything, like I look at the millennials and even the younger generation, I have nephews who are 2 and 4 years old, and just the world that they're coming into with like information coming at them so fast. We're constantly living in that fight or flight system of, stress. Like we're running away from the bear hundreds of years ago. There's no bears. But the bears are the cars and the jobs and the demands, and
It used to be where you could shut down, leave work at 5 o'clock, and you leave it at work, and you come back 9 o'clock the next day.
Yeah.
Now you take the homework, your phone's going off middle of the night. Next when you wake up and you have 3 messages, you have to return right away before you even get to work.
Yep, exactly.
It doesn't stop.
Yeah.
But in another sense too, how do you get yourself healthier enough to handle that load, even a minimal load, because now your body's overstressed.
Right.
Now your body is weak from the medications because you're not feeding it the right foods. How do you understand what that is for you?
That's where people like you and I come in.
Yes,
it's us. We have to educate people on how to do that. I mean, like, I try to practice everything that I preach.
Be the example.
Yeah, I try to eat the healthy diet. Do I slip up and have some less than healthy things from now and then? Yeah, I do. But, I have a daily meditation practice. I breathe every day. Is it always perfect? No. This morning was really challenging.
I know, probably got stressed out because it's talk today. I don't know.
No, it was my dogs. My dogs wouldn't let me.
Damn, dog, animals.
Yeah.
Little kids sometimes.
Yeah. And then I try to move. I try to move every day. Yep. And then I just recommend that to people. And the great thing, and I'd love to hear if this is true with chiropractic, with acupuncture, I talked about the fight or flight response, running away from the bear, that we're constantly living in that, it's called the sympathetic nervous system of the body. And it's run by our adrenals, which are 2 tiny glands on the top of our kidneys in your lower back. But acupuncture has been scientifically proven to actually flip that and put us into what's called the parasympathetic nervous system, which easily we call rest and digest. Yep. So most people that get acupuncture on a regular basis, they find that when they're laying on the table for 30 minutes and they've got all these little pins sticking out of them, they actually take a nap because their body finally goes into a place where it can rest. The cortisol level goes down, the adrenaline level goes down, and then I almost always walk in and I hear people's tummies making noise because they're digesting better. They're digesting whatever meal they just ate and haven't digested the whole time that they've been in fight or flight.
And that's exactly, I preach this probably, I do in office talk to new patients every month. This is the soapbox I go to because your body is under stress every day.
Yeah.
Okay. But the problem is the stress that affects you, how you react to that is different than me, based on my health state.
Right.
So when you're in a healthier state, you can tolerate that stress where you don't have the physical reaction of fight or flight, of the stress response, where your body stays in parasympathetic, the rest and relaxation state, so your hormones don't go crazy.
Right.
What I recommend, what I tell people is there's your stress hormones, catecholamines and cortisol. Those are your pain responses.
Yep.
They go up when you're under stress. You're more sensitive to things around you. Your shoulders do this when you're under stress. You hear a car coming, you do this. Okay? When you're in rest and relaxation, your body sends more endorphins, more adrenaline per se. When you work out, you produce those hormones naturally. So can you do things like acupuncture to allow your body to get to a healthier state, then over time let your body acclimate there so you become your normal state?
Yep.
And
absolutely.
learning things that Sharleen's going to talk to you about. At that point, how do you change your lifestyle so you stay in that state even when you're under stress?
Exactly. Or can you get to that state so much more easily and more quickly when you're under stress?
And because I know medical doctor will tell them, well, change your job, change your lifestyle. Once someone even told them, hey, make sure you get rid of your dog. That's me. Yeah. That's like I don't know, that's some type of ethical issue.
Yeah.
But how do we can't, and it's very difficult to change what's going on around us. Can we get healthier to handle that, then learn ways to maintain that? Because once you're in a stress state, you're climbing out of a hole. Do it yourself is almost impossible.
Yeah.
To do it under medication, it makes it even more difficult. Because now you're covering up, again, the branches, not the root of the problem. So by understanding, and just kind of summarize what you're talking about, by understanding that you need to get the help first, at least education. Okay, what do I have to do myself? Maybe working out, maybe stretching, maybe breathing, taking my dogs for a walk, whatever it can, to get your body to feel healthier, at least manually first. And over time, do other things such as foods, going from McDonald's diet, for example, to more a salad diet, to be extreme. Okay, can you do things to get your body to feel and over time look and stay healthy by giving yourself sometimes 2-3 months to get that change to happen?
Yeah, absolutely.
It doesn't happen overnight.
No, it does not.
And what does it take your patient that you've seen in the past to get to that healthier state and have the mentality and the attitude to stay there?
It depends on the patient. It depends on how willing they are to take my suggestions. I try not to word vomit on people all in the first appointment. I do like to just kind of plant little seeds, drop little nuggets in there, but I try to judge it on
everyone's different.
Exactly how the patient seems to be, and I love to ask a lot of questions.
Yes.
Let's say somebody's job is a huge source for their disease that I'm seeing, their dis-ease. I'm not the doctor who's going to be like, you have to quit your job. Everybody needs their job. Yeah. That's not feasible. And if I say that to them, they're going to immediately put that wall up and they're never going to listen to me. Yeah. But asking questions, do you have the ability to leave that job right now? No, I'm the sole provider for my family. Okay. Yeah. Do you have the ability to take 15 minutes at lunch and go sit in your car and do a 15-minute meditation that will keep you from considering murdering your boss or whatever it is? Yeah. Let's come up with a plan to get the problem working. And then to answer your question, how long does it take people, or it just depends on how much they want to listen. I've had some patients that are so motivated to get better, they will come every single day if I tell them to. They will change their diet as dramatically as I recommend. They will pay as much money as they have to take all the proper nutrient supplements that they need to get their body in the right state. If they do that, they're going to be ready, right as rain in just days. That'd
be almost sometimes death. Hey, look, this is my last chance. I'm going to need surgery if I don't get this done.
Yes.
They're going to put me in some type of ward somewhere.
Yeah.
I had to do something.
And honestly, the majority of my patients are in that arena.
Yep.
This is the last thing that they can possibly try, and so often I hear from people, I wish I would have come in here months ago.
Of course. Why haven't they heard of acupuncture or your office before? That's I deal with that every day.
Yeah. And part of it is, maybe they just they don't know about acupuncture, they think it's weird. People have recommended it to them, and they just don't.
Well, I have health insurance, Sharleen. Why would I see an acupuncturist out of pocket?
That's a big one too, for sure. And that's important for me also in educating my patients, is to educate them on the value of their health. And a lot of people aren't aware that, you pay your insurance premiums straight out of your paycheck. You never even see it.
And they only go up every year.
Yeah, they never even see it. I have great health insurance through my husband's job.
I'm jealous.
We have very low deductibles, but people don't know that. They don't understand what it means. So, if you have a major event, let's say you need to go to the emergency room for something, you're probably paying hundreds to thousands of dollars out of your pocket, whereas if you had come to see me and maybe spent $500, you wouldn't have been in that situation in the first place. So a lot of people don't even value their health until it's they're not like,
problem. Oh, okay, it's affecting my work, my home life. I can't relax.
Yeah.
My dogs, they're irritating me every day. What's going on?
Yes.
But that's what we're just talking about too, is that right now healthcare is kind of at a standstill in the sense where our insurance premiums, as a business owner myself, have gone up every year.
Yeah.
Your co-pays, and if you don't check yourself, have gone up every year. Your deductible, which is how much I pay out of pocket per year, has gone up every year.
Before the insurance will pay anything.
Exactly. And your out of pocket, your premium cost every month come out of your check, has gone up every year. The reason is people aren't healthy enough.
Yeah.
If people were healthier, the risk of having an insurance company insure you would be less. If there's less risk, there's less cost. Problem is, people, again, McDonald's, line out the door. At that point, because we're all in one pool now, the way I understand it, I'm not into a policy where, hey, we can either accept or not accept. You have to accept everybody. Because I'm the same policy as someone who goes to McDonald's, which is, I guess, McDonald's can be good, I guess. I'm not sure. Maybe I'm naive. I don't know.
I will put it out there on the interwebs. No, there is nothing good for you at McDonald's.
I don't know. So she's done research. I've done research yet. I'm taking that class yet.
I haven't done the research, but I'm pretty sure there's nothing good for you at McDonald's.
But if I'm the same pool as McDonald's, and I eat healthy, I eat at home, I watch what I eat, I watch what I drink intake for one, too. I work out enough. If I'm the same pool, I'm going to pay more out of pocket than I would if I was in my own pool. So realize your costs are always going up because people are always going to get sick, at least right now. This is not 2019. How do we decrease our own personal costs by doing things for us on our own outside of our insurance companies, keep ourselves healthy? Understand acupuncture, like you've gone through this last, I think it's probably half hour or so, allows people, I think, to understand how do you help people by listening to them first. When you listen to them first, and then you understand what they may need for their overall health.
Yeah, so just by listening, I'm able to put together a plan. Is it, especially if I'm working on internal medicine, is it something as simple as switching or removing one bad trigger food for them?
No.
Oftentimes it can be.
Okay, it is, but I'm thinking about the big picture of the person. Okay.
So so then.
Sorry, I was wrong.
Yeah. No, you're good. So it could be, in my eyes, that simple. For that person, is that switch going to be simple? Is it going to? Yeah, and it may not be. And I see quite a few patients actually to quit smoking. Which there's an acupuncture protocol for that. It's very well researched. It's very effective. Wow. Is it something that's easy for the patient to stop smoking? No. A smoker has probably tried dozens of times to quit, and they've most likely never succeeded. Bring in the acupuncture. If they come to me and say, I want to quit smoking, well, you gotta wanna. Like, how bad do you wanna? And if they're like, well, it's because my wife says she doesn't want me to do it anymore, or my doctor said I have to just to get healthy, okay, well, I'm not going to be able to help you very much.
I can do my part. But you have to put down the cigarette.
Yeah, exactly. You got to want to, let's come up with a plan. Maybe that plan is you smoke a pack a day, which, and now doing this, treating people who smoke, I know that there are 20 cigarettes in a pack.
Okay, congratulations. I didn't know that.
Yeah, I didn't either. I had to ask. But let's say they smoke a pack a day, which means 20 cigarettes a day. All right, where can we start? Can you cut it back to 15? Oh, no, that's not enough. Okay, can you cut it back to 16, 17? Like, maybe the answer is 19. Cut back one cigarette a day. All right. That's fine. Let's work on it. But it's going to take you this much longer to be able to quit. And are you going to be able to be alive the next day if you just cut down one cigarette? Yeah. Kind of. I always go I always go right to the point. Hey, look, how bad do you want this? If you want it bad enough for you and your family, then you want to do this or not? Right.
I don't want to waste your time, my time.
Yeah.
You can make me look bad if I don't help you.
Right.
I've worried about my own personal reputation sometimes.
Yeah. It's purely selfish.
Huge. Being sarcastic, but it's real hard. And I think a lot of it is, as we went through this, where there's a link between chiropractic and acupuncture, because we all believe the body's self-healing.
Yeah.
When we take away the toxins and increase the deficiencies sometimes in our bodies, and understand the whole person, not just the physical side, but the emotional side too, allows us to understand, hey, how do we help each person individually, and from them help themselves by educating them to what they can do a little bit better in their whole health, maybe mental or physical.
Yep.
Cool.
Yeah.
Anything else for your first show with us?
No. I love this. This is great.
And you're one of the few Caucasian, I want to say white, but Caucasian acupuncturists I know.
Oh, okay.
Was your school more different ethnicities or combination of both?
So I went to school in Santa Monica.
Okay.
It's called Emperor's College. I'm gonna pump Emperor's College for a minute because there's a reason I chose that school, and one of those reasons at the time was because they had one of the highest pass rates for the California acupuncture licensing exam. We call it PALE. And so it was a very well-respected school. I loved my school. My professors and mentors were amazing. I'm really glad I made that decision. Since I've graduated in the last 5 or so years, every year for the last few years, there's an organization, a national organization that puts out a survey to actually assess your rival schools, and then they're ranked
by acupuncture schools. Okay,
acupuncture schools, and then they're ranked on who, like, Emperor's College is saying is the best aside from them.
Got it.
Well, over the last several years, Emperor's College has ranked number 2 in the entire nation. There's only one school that outranks them, and so I'm very proud of where I went to school. They were
Congratulations.
great. And I got off topic there, but that I'm Caucasian. Yes, my school in Santa Monica, which is also a very diverse area of
Santa
LA.
Monica is just I grew up in West LA.
Yeah.
I understand where you come from.
Yeah, so Santa Monica is a pretty diverse area, and my school, I would say, was at least half, if not a little bit more, Caucasian.
Right. Good.
Definitely
not
way
good,
more, way more women than men.
Okay.
There are more female acupuncturists than men. There are more female patients who use acupuncture than male patients.
Yes.
But I would say the next largest group at my school was Asian, some form of Asian descent, and it was pretty mixed between Korean, Chinese, and Japanese, and then even a few Filipino people. But definitely, lots of.
Is it a lot of families where the daughter or son are trying to become an acupuncturist because there's a family business, or they were raised on it, or they've become there's medicine
anymore? I can really only think of one, and she's actually Caucasian as well. Dr. Maura Marco, and she works in Beverly Hills. And her father, who's the dean of the school we went to, and so he's an acupuncturist himself, and then so she grew up around it, obviously, and has chosen that as her profession. But honestly, I think most of us were probably like the black sheep family. Straight.
You want to do what?
Yeah, exactly. So I think there were a lot of us that were out
first
there.
time, hey, I'm going to jump into it and see how it goes.
And a lot of like second, third, fourth careers for people. I went to school with a handful of people who were, 50s, 60s, and they had, a couple of careers before, and they've retired and they've gone to study this medicine and now have an additional career. And
now that you're 5 years out of school, and obviously you stay in contact with your colleagues, how do you look at overall healthcare differently than when you were in school?
That's a great question.
I know, I have a couple, just like to a show. It's all I hope for.
Okay, I was a lot more jaded about conventional medicine when I was in school than I am now.
Why?
I think...
What do you mean by jaded, first of all?
Well, so I really hated conventional medicine and Western medicine. I try not to use Western medicine any longer. But I really, really disliked it when I was going to school, and it's, I think I was drinking the Kool-Aid, and I think acupuncture is the best, but as I've gone into practice, I see where I have personally shortcomings, and maybe the medicine has shortcomings, and where I see where chiropractic can be much more helpful in certain areas. And of course, I say all the time now to people, like, I can help you with a lot of things. Did I learn, like, Tuina massage and bone setting in school? I did, but if you break a bone, please go to the emergency room.
Yeah.
Can I boil ginseng, which the Chinese name is renshen? Can I boil that for 45 minutes and make you drink this hot tea if you're having a heart attack? Classically, theoretically, will it help you? Yeah, if you're having a heart attack, I don't want you to waste 45 minutes for me to boil this herb. Please go to the emergency room.
I'm not have it waiting for you at my door.
So I have learned much more in practice of, yes, conventional medicine has its place. It's really great at emergency medicine, whereas this 3,000 to 5,000 year old medicine that I practice is not great at emergency medicine. It's what they had 3,000 to 5,000 years ago.
Exactly.
We have way better technology now.
What you mentioned too is like, and I've been out for a little bit longer than 5 years, 3 times that amount. A lot of it is okay, I do this well. I can do this well. If you're not getting well with what I do, I would want you to go over here to get yourself well, not worry about my ego.
Exactly.
That's my thing. It's okay. I tell people sometimes they come in at an 8, 9 pain level, and I go, I'll give you 2 weeks of care, the maximum. If I don't see improvement, you're going for an MRI. You're going to go see your ortho. You're going to see your neuro.
Exactly.
So I want to make sure I'm not doctor says, instead of saying I don't know, I want to say I know where you should go if this doesn't work for you.
Exactly. And like referring out is really important. I do work alongside a lot of chiropractors, and you guys are really great with structural things.
Yes.
I am not always great with structural things. I can help pain, but if you have something that's really out of place that's causing you the pain, the root of the problem is to get it back into place. So I definitely believe in referring out, and we were talking a lot about I listen to my patients. I am not a psychologist. I am not a therapist.
No.
I am not trained in that. I can definitely listen to people. I can maybe provide some insight that maybe they're not seeing from their perspective. But have I had to refer people to professionals? Absolutely. To professional psychologists? Absolutely. Because there are things that are outside my scope, and our first thing in our oath is do no harm.
And a lot of people don't really live by that. They live by what they think is best for them versus the patient. And my best patients I get best reviews from are the ones where I refer out early enough, they get the proper care because they may have needed surgery.
Yeah, exactly.
It may have been that bad. They go, hey, look, thanks for me real quick because I needed this to happen. If not, it would have gotten worse.
Yeah.
People don't understand that that's sometimes important, is understanding where to go in the sense, but also, like you mentioned too, you're not a psychologist, but you can listen to them and help them feel a little bit better before they leave your office.
Yeah. I had a patient so long ago, right early in my career, who I was treating him for blood pressure. Acupuncture is really great at getting people's blood pressure to reduce naturally and stay that way without medication.
Perfect.
I checked his blood pressure. It was astronomically high.
Yeah.
I gave him a couple minutes. I checked it again to make sure I didn't do something wrong.
Yeah.
Again, same thing. It was over 200 systolic and it was over 120, I think, diastolic.
Yeah.
It was out of control. And I had to say, I either need to call you an ambulance or you need to get yourself to the emergency room.
Yeah.
He called me the next day and said they put me on meds. He was trying to avoid the meds.
Yep.
I understand.
Yep.
He says they put me on meds, but the ER doctor told me had I not come in if I had waited any longer, I would have had a stroke. And this was like a 41-year-old man. And he thanked me for possibly saving his life. And it's, I would so much rather the patient get better, even if I'm not the one who does it. That's why I do this.
Yeah.
I want somebody to get better. If I'm not the right person,
but they're coming in for you for help, but you may catch something else that they don't even know about, can be more of a medical emergency situation.
Exactly. Yep.
And when you build that trust with your clients you mentioned to initially, allows them to be more open to what else is going on in their life. And it really helps them overall to see the benefit of getting healthy and staying healthy. You give them more value that way, I think.
Yeah.
Cool. Anything else for your first show?
No, that was plenty.
That was a lot.
That was probably a lot of like I said, I try not to word vomit on people, but it might happen from time to time.
And we didn't do an acupuncture class. We didn't pull out the needles out. We talked about who Sharleen is, more about how she helps her patients, which I think is more important to get someone to understand. Okay, if I trust Sharleen, I trust how she can help me. Mm-hmm. And I think with any doctor, when you get that perspective, and you're treating your health instead of waiting to have a problem, you have an insurance policy or an advocate like Sharleen to help you navigate your health overall.
Yep.
And that's just my marketing for Sharleen. All right. Well, thanks for watching my show, Crooked Spine Show. Sharleen at Empire Acupuncture in Ranch Cucamonga. I'll put all the information, her phone number, her links to her Facebook, Instagram, LinkedIn, Facebook, Snap, whatever it is, too. I'll see you next show. Cool. That's it.
Bye.